Please join me in welcoming to the Distinctive Voices podium, Lee Chambers.
Thank you, and good evening, and a pleasure to be with you. This is a subject that's quite close to my heart, something I do work around on a regular basis, and I think Jennifer gave me probably a grander reception than I would have expected. It's a pleasure to be with you. And today we're going to look at, from my perspective, and something probably a little bit different to what you would normally have. And I've actually managed to create my own little side topic today by calling it disruptive voices instead of distinctive voices on my slides. So I think that would probably suggest exactly how I tend to approach the world, looking at things a bit differently, always challenging perspectives. And for me, mental health is something I'm quite passionate about. I'm involved on both an academic, a business, and a policy level. So it's something I get a lot of different vision and a lot of different angles of. That can be both a benefit, sometimes it can also be a bit of a challenge as well. But today I'm going to share some of the insights, some of the learnings, and some of the things that I've seen, started to understand, the wider teams that I work with have started to broach, and start to look at the future. In a lot of ways I've been told to try and keep it accessible, to remove all the typical jargon that psychologists love to throw around, and actually, to try and keep it quite light and a little bit, given that it's a topic that sometimes can be quite challenging to broach, trying to keep it light and trying to keep it optimistic in its own little way. So what I want to kind of do, first of all, for the keen-eared of you, you've probably noticed that not local to California. And when we kind of look and think about the pandemic and mental health, everybody across the world, every single human has mental health. And it's something that, at times we weren't taken for granted. But if there's one thing that really brought it to the fore, it was the pandemic. The pandemic was global. It suddenly made the world feel an awful lot smaller. And for me, flying to be able to talk to yourselves today, even in that step and on that journey, the world is a much smaller place after a pandemic made us consider how small it can actually be. Now, for those of you who are wondering, clearly not from California, but where is he from? As Jennifer said, I'm from the UK, so I live on the west coast of the UK, a slightly different west coast, a very much wetter west coast, north of Manchester and north of Liverpool. And that's really the basis for where we work, where I study, and where I try and make an impact. But what does that mean for mental health? Well, there is an aspect where we have to look at the global picture, but we also have to look at some of the small nuances and differences. So there are subtle differences. A lot of our research and a lot of our work is very much centred within the UK. And there are significant differences within the healthcare systems and the wider context of where mental health sits between the two different nations. So this is just, in some ways, a small thing to consider as I share some of these things, where some of it will be a lot more global, some of it will be US relevant and US centric, but the difference between the US and UK systems is accessibility, for one. In the UK, we have a universal access system that's free to enter. What does that mean? Anyone who feels like they are struggling can jump on the phone and see an MD, probably on the same day, and talk to them about how they feel. They can get prescription medication incredibly quickly. They can actually get therapy without there being any charge for accessing it, which is a massive privilege in so many ways that a lot of my fellow Britons don't really appreciate until they travel and see that that is something that isn't available everywhere. But that same accessibility does provide challenges, and there are significant waiting lists for many mental health services in the UK, to a point where in some areas it'll take you a year to be able to see a professional. And if you don't have the finances to go into private healthcare, you can find yourself in a very, very difficult place before you're actually able to access the very services you need. Another challenge is financial, both in terms of the impact personally and, again, in a system where that's universal in the UK. People in the UK are never bankrupted by healthcare. It might be or might give them a specific challenge. But at the same time, the safety net that we have in the UK is protective of people's mental health, because it quite often ensures that the living standard and the conditions stay to a point where they aren't as badly impacted. Also innovation, where because of the lack of commercial drivers in the UK, health innovation, especially around mental health, is behind the times. It's not had to innovate because it's a universal system. There isn't really a commercial incentive to innovate things, and therefore mental health provision in the UK is not only behind, but sometimes it's not even had to evolve over the past 40 years. And it's only recently that the Mental Health Act of 1970 is starting to be looked at to actually shape it for the future. And finally, demographics, which are slightly different between the US and the UK. And that presents different challenges again for access of services. But those subtle differences can make a difference. Now, I just want to very briefly share what my everyday is like before moving in to the topic at hand. Now, I have quite a multidisciplinary role. I do run an organisation. We do a lot around how we can use technology for the good to be able to engage people in healthy behaviours. I manage a multidisciplinary team who work with businesses to be able to apply initiatives that are proactive towards health and wellbeing. And I also work with the British Medical Journal to assess the efficacy, functionality and safety of mental health applications and technologies, as well as guest lecturing at a number of different universities and being involved in political and media commentary, trying to make complex topics accessible for the general public. And what that does mean is sometimes my days can be very different, but what I get real passion from is being able to take concepts and make them accessible for people who would struggle to access them otherwise. And through immersive experiences, we can actually support people in that journey. But what does that do for me in terms of having an overview? It means that I get to see things from a lot of different angles. Managing multidisciplinary teams is a real challenge at times because people have different priorities, different skill sets, very different fields of work, and have to try and bring them together for a common goal. Needless to say, I'm sure probably in your careers you've seen that and seen how challenging that can be as well. But the lessons you learn from that are, quite a powerful way to forge collaboration and also to appreciate that in terms of mental health, you often have to meet people where they currently are. And that in itself is a learning that, everyone can take. But I want to kind of dig a little bit deeper into why mental health became a passion for me. Well, firstly, because I had my own difficulties. But it's something that, from a workplace perspective, we have a labour force survey in the UK, part of the Office for National Statistics. And in 2022, British workers lost 36.8 million working days due to ill health and accidents. And 17 million of those days were lost due to stress, anxiety, or depression. 7.3 million were lost due to musculoskeletal disorders. And 6 million were lost due to injury through accident. And those statistics mean nothing without context. Because in 2010, those figures were pretty much reversed. Musculoskeletal disorders and the sickness days lost were actually more than days lost to stress, anxiety, and depression. And over the past 10, 11, 12 years, I've watched as those two lines have effectively crossed, and mental health sickness days lost has been on an upward curve, while musculoskeletal and accidents have been on a downward curve, to the point where they intersected, and now a lot more days are lost due to mental health. And really, it seems like very little has actually been done about it. So that's driven me to actually think, what can I do to make a difference? Because clearly there's an indicator of a growing challenge, and yet there seems to be little by way of, any kind of policy to drive different aspects, any kind of amplification of funding, and any kind of initiatives and decisive action to actually make a difference. And during COVID, that became more of a challenge. And 77% of those people in the workforce who were suffering from ill health, 77% of them were not present at work due to mental health, which means that it's not only a real challenge for every individual that's going through it, it's a significant economic challenge for pretty much every nation on this planet. And there's a significant human case, there's also a significant economic case. And yet, why are things not moving forward? So that was the first thing that really brought me into the topic and made me think, I want to know why that's changed, and I want to know what can be done about it. And I'm going to ask some awkward questions to be able to get a feeling and understanding of what it is that's changed. The second one was my concerns about the younger generation. So I have two children who are 10 and 8. They're a very different generation than myself, and growing up in a very different world. This graph shows different generations and their anxiety, the increase in some generations in anxiety reported and disorders. The top line is young people, 18 to 25. This is before COVID. So the last reported statistics on this particular graph in front of you were 2018. And what we can see is a real amplification, a real upward trend of anxiety in younger people. And I think it's sometimes quite easy to think, why is that? And there was a lot of studies started in 2015 starting to look at this. A lot of them were driven by the question, are things such as social media impacting the next generation's mental well-being and mental health? And for all the studies, there's been a lot of, not a massively clear picture of exactly how it is. It's a multifaceted challenge, and I think that's what we can say. But the screen time for that generation is extremely high. And also, they don't tend to sleep or exercise as much as previous generations. But for me, looking at this and looking at the wider public health perspective, there are some other considerations as well, because the younger generation, from a public health perspective, are actually quite astute. They tend to drink less. They tend to smoke less. They tend to use less recreational drugs. They are, in many ways, more switched on in terms of health. And it's something that's discussed an awful lot more. We tend to have access to resources, and I definitely know that I didn't when I was that age. But the thing that really kind of started to chime with me is it's okay to look at one indicator of anxiety. You can't take any conclusions from that. But I started to look across a whole range of other studies as well, looking at the things that have a correlation or an aspect that could give you a vision of where the trends were going from a much wider perspective. And the reality is, as I dug into a whole range of studies, whether it was for amount of medications prescribed, whether it was for depression disorder, whether it was for self-harm, whether it was for reported suicides, whether it was for reported sadness and feelings of helplessness, whether it was for feelings, of just not being connected to yourself and in the right place. For pretty much every metric that's impacted by mental health, there was a very similar upward trend for young people. And I think sometimes we look at COVID and think that is, a massive cause. And yet, at the same time, those young people were having significant challenges before COVID hit. And even though funding into mental health has continued to increase, those challenges have amplified in a significant way. And one of the aspects to consider is that puberty is starting younger. Because puberty is starting younger, and those same young people are searching, it does cause an aspect where they are more likely to then go online, try and find validation from peer groups, from others, and actually find the struggles there. But ultimately, this trend started before COVID. And for young people, given that mental health incidence in adolescence, it's quite likely to then lead into specific challenges with mental health in adulthood as well. So it was those two things that got me interested in really digging a bit deeper into the field and taking me away from some of the things that I'd done previously. But I think whenever looking at mental health as a concept, we actually have to consider what we don't see. Because it's easy to look at the studies that already exist. It's easy to look at data that's readily accessible. The challenge with mental health is, as a concept, it's still got quite a bit of stigma to it. It's still a challenge to actually find those who are struggling. Not everyone accesses services. Not everyone wants to be part of a study. A lot of people suffer in silence of struggle. And sometimes the very research that we look at for answers doesn't actually show us the full picture. And in itself, sometimes taking that step back for people who are in the field and appreciating that actually awareness is increased, but the ability to actually express and find those words maybe has presented some challenges as well. And actually, we can all appreciate that within that field and within the wider aspects of what we consider, that actually we haven't got the full vision of things at all times. And that means that we always have to look a little bit wider to actually see what the impacts are. So thinking about mental health and coming into COVID, it's only natural that something so significant would present a set of challenges. Something that for a lot of people, if we think about the words at the time, unprecedented, uncertain, a new normal. And while this specific infographic, having looked at a range of other indicators across other countries, is in some ways on the extreme side and has been presented in a way that makes it accessible to a wider range of people, it's quite clear overall that in those first few months of COVID, yeah, there was a level of novelty to the world changing so quickly. But there were also an awful lot of challenges that people started to face. And I suppose when we kind of look at it, in itself, it put us in a challenging position. Thinking for those of you that are here today and those of you that are tuning in online, the difference in people's COVID experiences is really wide, very broad, and quite different as you engage different people. Some people were able to weather it and navigate it a lot easier than others. And as we kind of think about, COVID definitely impacted everyone. It was a global pandemic. And some people talk about it like it's just disappeared. And I think, in itself, the psychological distress that was caused by the pandemic, for some people, showed quite early. For some people, there's aspects of delay in there as well, where it's not as apparent, and actually their ability to be resilient and endure some of those aspects will actually raise challenges in the future. And as we get to a place now where there aren't crises happening to distract us, a lot of people started to talk about perma-crisis and polycrisis. It was COVID, and then it was the war, and then it was financial challenges, political unrest, the cost of living. But across a lot of nations, 2023, there was a lot of hope that things would become a bit more stable. And it's sometimes in that stability where you actually start to see those who've been enduring start to struggle. But seeing that initial spike in the work that I do, alongside numerous studies and pieces of research, got me asking a question about how can we start to understand what's COVID and what's people struggling with the anxiety of uncertainty that is normal in such a situation. Something that for many people, they've never been through anything, any level of adversity or change that dramatic. So it took me into a piece of research with Professor Nikovic and Professor Spada in the UK through UCL and Kingston. And it was looking at creating a specific scale for COVID anxiety and seeing if we could, in some ways, segment those aspects away from the typical mental health disorders, such as generalized anxiety disorder, health anxiety, to see, was there something specific about COVID that was actually presenting people with challenges, and could, using that scale, help us to see if there were patterns that could then support treatment, looking at those specific aspects. So COVID anxiety syndrome itself, it's not a DSM-5 disorder. It's not something that you could be directly diagnosed with. It's a set of symptoms that appears and is different than your typical diagnosis schema for mental health conditions. A lot of it surrounded taking certain symptoms of depression, of obsessive compulsive behaviours. A lot of it was around safety and hygiene obsession, but also significant fears of death, fears of illness for others. And it generally show us continually checking, continually scouring for information. And even when things started to ease and times became a little bit more normalised, there was still significant challenges and a feeling of continually being under threat. And being part of that made me start to think and consider, after that initial spike, things started to come back down, but a small subsection of people, of those we were working with in the UK, about 9%, had those persistent symptoms of psychological distress, and they weren't reducing. And that started to get me interested in that psychological distress element and why those individuals weren't, like the rest, 91% of the populace, starting to find some level of stability in those challenging times. But also got me to start to think about what could the post-COVID impact be of those who had persistent psychological distress in those times. And how could we actually support those people, those individuals, by using the knowledge of treatments and interventions that we already have to look at those specific patterns of symptoms and what we could actually do to make a difference for them. But looking at COVID as a whole, in that first year, looking across all the studies that were done during those challenging times, the global prevalence of anxiety and depression increased by 25%, which is significant when we look at it from a global scale. And digging a little bit deeper into why, there were numerous stress factors impacting that. Multiple different demographic groups had amplified impacts, and it really highlighted deficiencies in our mental health systems, from policy to care. And a lot of people started to realise it actually just wasn't an isolated challenge. It wasn't just an individual, get yourself better, but it was actually a collective, systemic challenge to be able to advance the conversation to a point where we could actually start to look innovatively at what we could do, rather than looking at it as something that we could just let continue to be a real struggle for millions of individuals. So I suppose what I just want to do is consider some of those groups and the stress factors that they faced, because as we start to extrapolate and look about who was affected, you start to realise that groups were affected differently, and there were commonalities in how those groups were affected. And the first group to look at is women. Women were significantly more impacted by COVID-19, and there was a number of different aspects to that. There was a level of economic stress because of the nature of the job market. More women lost their income or were forced to go part-time or had to take on childcare as educational institutions shut, and it impacted their earnings. In itself, it also impacted the amount of unpaid work that they had to do, from care to a lot of other different aspects. There was more domestically. And yeah, that presented a challenge, but also there was challenges around the violence that women faced from a number of different aspects as well. And there were, again, some significant figures for how women were impacted. There's also the reduced access to services. Now, women tend to access health services more often for a range of different aspects, but with services reduced and accessibility being less, they were less likely to access those services, especially for women with lower incomes. And the other health inequities that exist for women were amplified by COVID, as things were focused on specific aspects and other aspects of healthcare were in some ways neglected. Did we need to do that from a perspective of trying to, manage a global pandemic? Yeah, but it's wrong to ignore the fact that for some services, they found themselves right at the bottom of the pile. And again, if we kind of think about the negative impact, it has impacted women more. And that now shows in mental health statistics today, of the fact that, especially for young women, there are some significant challenges that we face in the future as a group, as a collective, but also as a demographic that sometimes isn't recognised for the actual challenges that they're currently going through. Another group that face challenges were those from racial and ethnic minorities. And just through COVID itself, the actual death rates and poor outcome rates for those from racial and ethnic minorities were extremely bad in the UK, and they were mirrored really across a lot of other nations, where the outcomes from a health perspective, the death rate, and just generally how they were accessing services, and the inequalities again showcased that inability to actually access those services caused a range of issues. The mistrust in the health services from some ethnicities, some of the challenges around minority stress from things that they face discrimination, do impact mental health, but they also have a potential to impact how people access healthcare. And the living conditions as well for a lot of people of different ethnicities tended to be less affluent, more cramped, poorer environmental conditions. And there is, an element of bias in care. And that exists quite often unconsciously in the systems that care for us. And in itself, the types of challenges that we faced, the types of challenges that different races and ethnicities faced across COVID were amplified. And again, in a similar way to young people, they were having significant challenges before, from everything from cultural appropriate therapies to trust in health services, to actually accessing health resources themselves and appreciating the importance of looking after yourself. Another group to consider within this is those who worked in essential positions, especially healthcare workers. And may well be some of you in this room, but an appreciation for the aspects and the challenges of being in those positions, the exhaustion from working with a lack of resources, the trauma of trying to care for people in those times when many people were actually struggling to stay alive. The compassion fatigue of caring and yet not being able to make a difference. The helplessness of the people you're caring for not making it and struggling. And the continued exhaustion and burnout that a lot of medical staff started to face as they worked on the front lines throughout. And I know in the UK, on a Thursday, they started clapping for nurses. That's great. But ultimately, the conditions that they faced were significant. The risks that they faced were significant. And actually, there's an underlying aspect there where it started to impact the mental health of those very people looking after and caring for others. And they're another demographic that face challenges. And in itself, it gets us to start to think about the different aspects and demographics who have faced challenges throughout the period. Another one I just want to quickly highlight is those with disabilities, who in a study that I supported were actually facing 4 times the levels of psychological distress in the early months of COVID due to the loss of their services, the poor health outcomes that compounded upon the challenges they already faced. An example of this, I coach a disability soccer team for adults with disabilities. And when COVID hit, the Soccer Association said we couldn't play. That event that brought them together, that gave them an opportunity to express themselves socially, emotionally, an opportunity to feel like they belong, was lost overnight. And it's still very difficult to get that back up and running properly now, 2.5 years later. But, you know, with the removal of those social opportunities, a lot of people with disabilities had challenges as well. And for those on low incomes, we know, looking at COVID, it amplified the inequalities and the inequities that groups face. And the economic hardship of COVID is something that, if you've not really had to consider it, it probably isn't on your radar. But for lower income families, those positions that they might potentially lose, the hours they might have to reduce due to childcare, access to healthcare, especially in the States, is reliant on your ability to actually afford it. And, as people found them having to manage their finances, sometimes in a very tight way, what's one of the things that you're going to start to, maybe push back on and not spend and not have to utilise? Yeah, and that would sometimes impact food, the very food you could afford to buy and consume, the housing that you could live in. It made people and put people into difficult choices, and that economic stress in itself, especially around childcare and being able to actually, cover that. Something else that, another group where we actually saw real challenges and an increase in incidence of mental health. But I just want to come back to something that got me interested in this field in the first place, and that is the outcomes for young people. Because, like I said earlier, young people are the adults of the future. If I think about the work that we do with businesses, young people will be coming into those businesses. If they have had those challenges, if they have and are suffering with mental health conditions, that becomes something that has to be managed. And it means that for a lot of young people at the minute, they haven't got the support they need. And there are so many different societal reasons why that might be. But for young people, losing that academic anchor that they had through school, missing that time with the peers, the social isolation, the fact that so many don't get out like you've done today in this theatre, they're much more likely to be sat inside, isolated. Yeah, having friends on a headset might make you feel like you're part of something, but it doesn't replace that physical interaction and actually being part of a group. And yeah, we kind of look at the aspects for children and we think about the actual knock-on impact, the impacts of their parents losing their jobs and how that impacted, the children in terms of, again, the housing, what they were eating, how they were being looked after. There is, and it's a difficult topic to talk about, but there is emotional and physical abuse by parents and caregivers, and it happens. And, across COVID, one of the things that we did see is that for a few people, actually going to a workplace was their safe space, and their home environment was the toxic, challenging place to be. And all of a sudden, with workplaces closed, they were very much trapped in a place that wasn't productive to their mental health. But again, for young people, a lot of them haven't had the ability to grieve either. If they've lost family members, where funerals weren't able to take place, were limited on numbers. And I speak to a whole range of young people across different settings. And there's this expectation that because they're young, they're resilient. You know, they're resourceful, they'll get through it. But many of them are struggling and have had a range of challenges over this period. So, bringing it all together, this was a study done in 2021, taking into account studies from a range of countries to try and get an overarching view on the impact of the pandemic on the global mental health. And what it ultimately shows is that younger people were the hardest hit. For anxiety disorders, depression disorders, the increased prevalence was in those younger people, especially in adolescence. And let's be honest, it's a challenging time to navigate without a global pandemic, especially in today's world where there are so many options and choices for what you can be, but sometimes so little clarity on how you actually get there. And in those kind of additional mental disorders and cases, there's significantly more females being diagnosed. And I think it's easy to sometimes wonder, are we over-diagnosing these things now? Is this increased awareness mean that so many people are coming forward? But I actually think, the awareness has been important. If anything, if I think about the Labour survey and that increasing line of mental health, it's because people are becoming aware of it and starting to go and actually access the support that they need, or at least try. I think it's very easy for people to walk around and say, well, we're having a mental health pandemic, we're in a mental health crisis. But then people read that online, they hear it on the news, and for some people, it makes them feel even worse about things. So it's really important sometimes the language that we use and how we try and, continue to work to destigmatize it. Now that makes for pretty depressing listening to. Hearing all the groups that have struggled, seeing the increase in figures, thinking about the next generation all struggling. But I want to leave, with a little bit of positivity and a little bit of, what can we actually learn? What can we take away? Well, if anything, the pandemic has really shone a light on how important mental health is, how everyone has it, how adversity doesn't actually discriminate in the way that sometimes we think it does, and how we've actually all been through a collectively difficult time together. It's also shown how important social connection is, how important it is to actually have those friendships and have those, familial groups to support us. It's also shown that some aspects of the digital world can be powerful. Digital therapy, access to digital resources has become easier and allowed people who are struggling to access the traditional methods and given some light to a new way that can be used positively. I say that because it really does need to be used positively, and there are some challenges in how digital therapy and digital help is currently being delivered. But that's one of the many things on my list to try and work on to ensure the efficacy is there without the challenges around safety and trust. But it's also got us thinking more about mental health became a really individual thing. It's about you're struggling, you need to get better. But COVID actually brought us together to realise that actually sometimes it's a collective thing, and the isolation and loneliness that a lot of people felt, they actually saw, I can't just do this on my own. In fact, it shouldn't just be on my own. We have our own social well-being and need to bring that together, especially from a public health perspective, because across the world, and if we look at countries such as the UK, the US, Canada, Australia, how much of the public health budget is spent on mental health? Generally, about 2%. About 2%. And in developing countries, usually about 1%. It doesn't get the funding it needs. And if anything, the light has been shone on it to actually show that policymakers, governance, needs to actually take some action and push forward on that. And it has shined a light as well on those disparities and which groups have been impacted more. Don't think that's talked about that much, but in my world, it's one of the big things that I'm focused on. And that's a lot of what we do in the workplace is looking at those groups of lesser privilege and how their health has been impacted. And finally, it's made us think. We went into COVID, as you've seen from some of the studies, not in the best place in terms of mental health and how we were supporting people. And if anything, probably the biggest lesson is that the pandemic isn't going to be the last challenge that we face as a species. We actually need to prepare ourselves and really prioritise mental health now so that next time we enter a significantly challenging time, we enter at a higher level, a higher benchmark, in a better place to navigate the natural challenges that come with uncertainty. And what I want to leave you with is hope for the future. The things that I've seen, I'm working on, the newer research that's coming forward, and the things that actually are giving us some hope and optimism that we can start to take mental health forward in a positive way. The first one is the use of tech in a good way and in a way that actually supports people to become more emotionally engaged with themselves, in a way that actually educates proactively and positively. Also, aspects around community. We know how important community is. If anything, the pandemic made people go and find out who their neighbours were. And it's brought people together. It's also made people think about the interventions that we can do in terms of mental health. And instead of them always being medical and individual, we can actually look at how they can be social and community focused as well. Integrative care, we're actually not just looking at mental health in isolation, because that's been another challenge. We look at it in isolation. There's so many factors, so many variables, and we are starting to look at it in a more integrated way. How does it plug in to other aspects of the wider social and medical care system? How can we actually utilise those areas to collaborate, to ensure better outcomes for people, and that they're actually able to access support before they hit that point of crisis? And also some of the evolution and some of the better understanding of how to deliver different types of therapy and intervention in a culturally appropriate, sensitive and responsive way. Because in itself, if we're looking at some of those disparities, some of them are caused by systemic challenges that are wicked in a way to try and solve. They're actually beyond mental health. They are structural and systemic challenges that we face as societies that need an awful lot of work beyond what any one group of psychologists could do. But those culturally sensitive aspects, they kind of understand the aspects of those accessing and therefore are actually able to not only help them on that journey of their mental health, but actually feel like it's a therapy that's appropriate for you. And as we start to think about the future and things start to need to become more personalised in that aspect in terms of care, but also looking a lot wider at how it can support people together. And just a few of the things that I've seen that are really interesting. We hear a lot about adverse childhood experiences and the trauma that children go through and how that impacts mental health. But actually starting to look at positive childhood experiences and how they can be protective of mental health if we can increase them and help children to be able to see them and utilise them. Using the education system as a more powerful tool ensuring that, teachers, people within those systems and structures, children are there most days. It's a great place to consider screening. It's a great place to look at how we can, train people. They don't need to become psychologists, the teachers, the pastoral staff, but they have the power to be able to make a difference to a whole range of young lives through being able to actually offer a little bit of appropriate support, as long as they also get the appropriate support as well. And finally, building capacity into systems, and again, we have lots of institutions that people trust, that people connect with, and as I start to look to the future, things are getting better in a whole range of ways. There are a lot of innovative ideas coming to the fore, and while we do face significant challenges, if there's one thing I want to leave you with, it's that we all have a role to play. Looking after ourselves where we can, looking after those around us, and by just a little bit of care can go a long way. So thank you for taking your time this evening to join me, and for those online as well. And we'll continue to work on this together and increase mental health outcomes for everyone. Thank you.